In order to facilitate examination of the lens and posterior segment, a mydriatic will need to be used. In a diagnostic situation, it's important to remember not to use atropine sulfate unless it is already part of a therapeutic regime for the patient. This is because of the extended duration of action of atropine that is seen in many patients. Medication with tropicamide, brand name Madrasil, will allow short-term mydriasis and also allow a good lenticular and posterior segment examination. Once the patient is mydriatic, then I start the lens examination either using a focal light source or slit lamp biomicroscope. Remember to examine all regions of the lens, including the equator, as this is an important region of lens pathological progression. Examination of the vitreous will also be possible once the pupil has been dilated. It's easy to forget to examine this structure of the eye, but it may give you important information in cases such as equine recurrent uveitis or feline immunodeficiency virus. There are three forms of ophthalmoscopy: close direct, distant direct, and indirect. Distant direct is dramatically underused and will give you a lot of information about opacities within the visual axis. The technique requires that from arm's length away, the observer looks through the ophthalmoscope on a setting of 0 diopters for a normally sighted person and uses the tapetal light reflection to assess whether there are any black opacities present within the visual axis. These may be located anywhere from the precorneal tear film through to the retina. Once a black opacity has been discovered, it is important to assess if it moves within the visual axis. When the examiner moves from left to right or up and down, if the opacity remains static, then it's within the plane of the pupil. However, if the opacity moves in the opposite direction to the examiner, then it's in front of the plane of the pupil, and if it moves in the same direction as the examiner, then it's located behind the plane of the pupil. This technique can be used to help differentiate nuclear sclerosis from cataract, as the nuclear sclerosis will still have a clear tapetal light reflection despite the obviously grey appearing lens on focal illumination, whilst cataracts will block some of the tapetal light reflection, resulting in a grey or black opacity.